Good morning, friends. Welcome to our next learning session. And today I am going to talk about a case which I saw in 1968. And here I want to show you certain things and want to tell you in reference to our case. What is an embolus and what is embolism? An embolus is a particle that moves about in the blood vessels, either in the veins or arteries. Most emboli are composed of clotted blood cells, but this embolic material can be air or some fat cells or some other material. The embolus moves in the body inside the blood vessels, and it may block the blood vessels during its passage. It lodges there not allowing blood to flow. The cells that normally get their blood supply via this passage are starved of oxygen and die. This condition is called embolism. The material is called embolus, and the dead tissue is called infarct. And embolism, look here, an embolism is the lodging of an embolus, a blockage causing piece of material inside a blood vessel. The embolus may be a blood clot, or as I said before also, fat globule. It is called fat embolism. A bubble of air is called gas embolism, or amniotic fluid called amniotic fluid embolism, or some foreign material. An embolism can cause partial or total blockage of blood flow in the affected vessel. Such a blockage, that is vascular occlusion, may affect a part of the body distant from the origin of the embolus. An embolism in which the embolus is a piece of thrombus is called thromboembolism. Now, a pulmonary embolism is a blood clot that blocks and stops blood flow to an artery in the lung. In most cases, the blood clot starts in a deep vein in the leg and travels to the lung. Rarely, the clot forms in a vein in another part of the body. When a blood clot forms in one or more of the deep veins in the body, this condition is called deep vein thrombosis, or DVT. DVT, or deep vein thrombosis. Because one or more clots block blood flow to the lungs, pulmonary embolism can be life-threatening. However, prompt treatment greatly reduces the risk of death. Taking measures to prevent blood clots in your legs will help protect you against pulmonary embolism. Now, you need to see few diagrams to understand this, what I am talking of embolism. See this diagram. See, this is the right lung, this is the left lung, and in between the two lies the heart. This is a large vein which is bringing blood back to the heart from the lower limbs, abdomen, and lower part of the chest. All the blood comes through this vein into the right atrium, and from right atrium to the right ventricle, and from right ventricle through this artery into the lungs. This is the pulmonary artery. This is a big artery. This is a pulmonary artery, and this at this point, you see, try to mark this point. This is the aorta. This is coming from the heart behind this artery. This is coming like this, arching like this, and then goes behind the heart itself into the abdomen. Now see this. This has got some 3 arteries coming out of it, which goes to the head and neck. The artery goes divided into two. One goes to the left lung, the other goes to the right lung. And this is a block here, or it could be here in the pulmonary artery, or in the branch of the pulmonary artery, or in its further branches. As the pulmonary artery's branches enter the lung, they keep on dividing again and again to form very small branches which surround the alveoli of the lung. The alveoli are the basic units where oxygen and carbon dioxide exchange occurs. This is a just very thin membrane between the blood and the air, and therefore oxygen can easily diffuse into the blood, and carbon dioxide from blood can easily diffuse back into the alveoli. But when the branch is blocked by the embolus, this portion which was to get blood from it, it becomes dead. Friends, I may tell you that lung gets double blood supply. It gets pure blood from the aorta through bronchial arteries, but the large blood supply comes from the pulmonary artery, which is deoxygenated blood, which comes from the right ventricle through the pulmonary artery and goes to the lungs, gets oxygenated and comes back into the left atrium by 4 pulmonary veins. Now here today we are concerned only with this main thing, that when the branch of pulmonary artery, a smaller branch of pulmonary artery is blocked, then the area which was to get blood from this arterial branch, that becomes dead. This is a pulmonary infarct, and the material which blocked it is that is a pulmonary embolism. Now see this side, there is a block here, there is a block here in this artery, this is a block, this is a block, and this area has become dead of the lung. So this is what is called pulmonary infarction. Now I will show you one more diagram which when you take extra chest, then what happens? You see, this is the extra chest, this is the right side, and this is the left side. This is the heart, this portion, this is the heart, and this is the aorta. Now you see this prominence, this is a part of the aorta which is called aortic knuckle. This is called aortic knuckle, and this from here it takes turn like this and goes behind the mediastinum and heart, and then into the abdomen. This portion of the heart is the left ventricle, this portion is the right ventricle, this is the right atrium. Now the blood supply is cut and you see this area white. Normally the lung should be blackish with streaks of white, which are the blood vessels. But here this wedge shaped area, you see, this is wedge shaped area, this is the wedge shaped area, this is all white because this is the dead tissue, and this is what is called pulmonary infarction in X-ray chest. And this is what was being looked into by my consultant, which I am going to narrate the case now. It was 1968 when I was working as junior house physician in the Department of Medicine in the Medical College Rohtak. The procedure was such that the patients were admitted from the OPD into the ward. We had 2 units of medicine, and I was working in one unit which had 80 beds. I was looking after 40 beds, whereas the other physicians were looking 20 beds each. And one observer was posted in the laboratory to carry on the routine tests of the patients in the ward, and I had to look after these patients. One of the patients was admitted with the complaint of difficulty in breathing. Difficulty in breathing is called dyspnea, friends, and those who know little bit of the medical side, they understand dyspnea or dyspnea, but for those who do not know these things, they should satisfy with this word that there was a difficulty in breathing. So after 2 to 3 days, I presented the case to the consultant and I told him that his dyspnea has increased, his difficulty in breathing has increased. So he asked me to get an X-ray test done if patient might be having pulmonary infarction. As I have shown you in the diagrams, he was expecting a wedge-shaped shadow in the lungs showing pulmonary infarct. I got the X-ray done and presented the case next morning, and the same answer came that get the X-ray done. I showed him the X-ray which was perfectly normal. So now he said that you give him the injection darifylline. Friends, darifylline was a bronchodilator. That means it will open up the air passages. In bronchial asthma, the air passages collapse like a plastic tube and patient cannot get the oxygen and therefore gets difficulty in breathing. So he when darifylline opens up these blood vessels, and we used to frequently use it. So when he said give injection darifylline, I asked him, sir, there is no bronchospasm, how darifylline will help? So he did not expect this type of query. I wanted to clarify, sir, this is the teaching round and I want to know what we are doing and how it is going to help us. So he said that it has got mild central respiratory stimulant action. That is, the respiratory center in the brain will be stimulated. This was a totally wrong answer. It is not like this and that is not going to help. But anyhow, I asked him that then why don't we use mycorrhin, which is a more potent respiratory stimulant than the coramine or than darifylline. So he said, all right, you give mycorrhin, and went to the next patient. So basically this was the type of faculty which was teaching us. Not that all faculty was like this. There were some really good teachers also, but what I wanted to tell you today was that when blood clots in the deep veins of your cough, the condition is called deep vein thrombosis or DVT, deep vein thrombosis. The cough veins are quite deep inside the muscles and they get this block due to clot formation, and a piece of this clot gets detached and goes to the circulation and gets lodged somewhere in one of the pulmonary arterial branches and causes pulmonary infarction. This condition is fatal. Patient may suddenly die, and little more care can prevent this type of catastrophe. What you need to do is that if the patient is bedridden, the patient should be given movements to the feet and legs. Simply moving the feet on ankle up and down. This is called up movement is called dorsiflexion, and down movement is called plantar flexion. So alternate up and down movement on the ankle keeps the muscles moving and therefore keeps the blood in the veins moving, and if the blood is moving, it cannot clot. Similarly, moving the legs at the knee joint, up and down movement, flexion and extension. Only two movements occur on the knee joint, flexion and extension, and if it is done, this also keeps the blood moving. So this is a very important thing for the bedridden patients, and this can help us to prevent such a dreaded disease. So friends, continue your support in the form of commenting, liking and subscribing the channel. I want to make a request to you. Every time I have said before also that please do not give your comments on the messenger. I am just giving you the link on Messenger so that you can easily see my video. You don't have to search it in YouTube. But some of my friends are so nice that the moment they get the link, they give a thumbs up sign. This does not mean anything. You must understand this thing. This is just wastage of your time and my time. And I am sorry, but I don't have time to waste. Therefore, I don't expect that you will reply to this. Your reply is in the opening of the video by clicking the link and then watching the video. Then you can, if you like, you can give thumbs up there, and if you want, you can comment in the comment column. You can comment about the video. You can comment about any future topic which you want to me to tell you about. So friends, thank you very much, and we will meet next time with another interesting topic.